Yo, what's happening? This is Coach Christian here. I'm going to be helping you out with a corrective exercise video focusing on the knee. So if we have any knee issues, any kind of knee pain, this is the video for you. So we're going to go through a couple of things with the overhead squat assessment. Let's go ahead and bring this down just a tad here. Just a tad. With the overhead squat assessment, the main things you're going to see with the overhead squat assessment, we're going to keep those feet forward, about shoulder width apart. We're going to keep those hands nice and high. Now, if we have knee issues, what we're going to see is those knees want to buckle in. And that's going to tell me a few things. Maybe we have a tight adductor or a weak glute med, because our glute med is actually what keeps that knee coming out during the gait cycle. So if our glute med is weak while we're walking, what's gonna naturally happen is it's gonna buckle that knee on one leg here. So to keep that knee coming out, this needs to be nice and strong as we're walking forward. So it could be that, or it could be a tight adductor here. But it could be a multiple things. There's a lot of muscles that attach into that knee. So we're gonna go ahead and work on those today. So first thing we're gonna do is go ahead and massage some areas out to see if that would be the issue. So we're gonna massage areas out that connect from the bottom up into the knee and from the top up into the knee, and also that glute, because that may be a part of what's not keeping that knee out. A lot of people don't think about the glute being an issue with the knee, but we're gonna work on all of that today. We're gonna start off by massaging out the calf. So to do that, we're gonna go ahead and use our foam roll here, and we're gonna go ahead and put one leg on top of the other. In this position right here, we're gonna go ahead and find a tender area, and now we're gonna go ahead and flip to the left and to the right. This is gonna feel pretty painful. If your calves are nice and tight, this is gonna be a painful experience. But trust me, after a while, it does get easier. After a while, you might actually wanna lift up and put a little bit more tension on there, coming from the left and to the right. We really wanna massage that area out, get that calf muscle to release, because that may be attaching into the knee too tightly and causing that to be the issue. So we're gonna go ahead and do that on both sides. You know, I massage out, flipping back and forth on the most tender area on that calf, minimum of 30 seconds. You know, we really wanna release that muscle. I like to mess around with it, you know, find different areas, get all of the tenderness out of it. And that takes a little bit longer sometimes, but putting a lot of pressure, minimum of 30 seconds, back and forth, maybe 3 or 4 times, really release that muscle. After we've done that, what we're gonna do is actually stretch out that calf muscle now. And to do that, we're gonna get into a stacked position here with our knee right underneath our hips. And then we're gonna have our wrist, elbows, shoulders all lined up. From this position, we're gonna go ahead and tuck our toes here, and then we're gonna get into a downward dog. So you're gonna go ahead and push yourself up. Coming into that downward dog, we're gonna push one heel down to the ground. My left heel's pushed down, then you're gonna feel that nice stretch here in the calf, and then you go ahead and switch it out. Push that other heel down, extend that knee, really get that stretch down the back of your leg right here. That's gonna stretch out the calves. So we massaged them out, we've stretched them out. Now we're gonna go ahead and get into the adductor. Like I mentioned earlier in the video, the adductor is a main component that's actually keeping that knee, it's attaching too tightly into that knee, and it's gonna cause an issue as well. So what we're gonna go ahead and do is get into like a Spider-Man position. So our leg is gonna be straight out perpendicular to our body. And what I want us to do is kind of find a tender area. It's gonna be a little bit further forward on there. We're gonna find that inner thigh area, find a tender spot. Then what I want you to do is extend that foot all the way out and flex it back in. Once again, this one's gonna be a little bit painful, but it is gonna be very, very helpful in releasing that muscle so that we can fix that knee issue. So really extend and flex. Once again, we're gonna find that most tender area, and we're gonna do it for a minimum of 30 seconds on both sides here, on both sides. Now, after we've done that, we're gonna go ahead and stretch out that inner thigh. My favorite stretch to do that is the frog pose. So we're gonna go ahead and spread our knees as much as possible here, keeping those toes in towards each other. We're gonna go ahead and come down into the forearms, pushing those hips back, and then come out forward as much as we can. Then push those hips back, butt into those heels, and then come back forward. We're gonna rock back and forth, maybe about a minute, 2 minutes. I like to do these stretches for quite a while, kind of hang out in this area. This is where you're gonna get that deepest stretch, really stretching out the inner part of the thigh here. That's gonna be working the adductors here. So after we foam rolled and stretched that, the next thing we're gonna move to is the quad. the quad also attaches into the knee. So what we're gonna do for that is we're gonna jump onto the foam roll. Now, on the foam roll, you can do this with one leg or two legs. I like to do it one leg at a time because I like to be more specific, but you can put both of the legs on there if you want to. So we're gonna find that tender spot. Go ahead and find where you feel most tender, and then you're gonna flex that heel all the way in towards your butt as much as you can, and then extend it back out. This one's gonna be pretty painful. All of these massage techniques are pretty painful if you have tight muscles. So go ahead and flex it all the way up and then back down. Once again, we're gonna do this for about 30 seconds, really massaging that area out, 30 seconds on each leg. After that, we're gonna go ahead and try to stretch out that quad, right? My favorite thing to do that is called a couch stretch. So you can do this on a couch. You can also do this on a wall for a little bit more deep stretch. So what you're gonna do, if you notice, the back of my foot is on this wall, my knee is pushed up as far as I can into the wall. In this position, you're gonna come into a lunge. Most people are not gonna be able to come out of this. You're gonna stay here, and there's already a very, very deep stretch into that quad. If you can only do this, that's perfectly fine. Eventually, you'll be able to come up to the top here and lean up. That's gonna get even more of a deep stretch here, holding onto that knee. We're gonna do this stretch for a minute or 2 minutes on both sides. That's really gonna open up that area right here. All right, so the last thing we're gonna try to do is open up we're gonna try to work on that glute, right? That glute med is really weak, and usually it might be because the piriformis is overworked. The piriformis is a little tiny muscle inside the glute as well, and that's what happens when our actual glute minimus and glute maximus is not working properly. So what you're gonna do is go ahead, think about the top of your back pocket. If you were wearing jeans and you had a back pocket, think about the top of the back pocket is the area that we wanna put this ball, and then we're just gonna kinda hang out into that area, letting that ball massage deeply into that glute. And that's gonna kind of open up that area. Also, they have the TFL on the other side, which would be on top of the front pocket. That's another good area to massage as well. These are all very tiny muscles, but they hurt like heck because they tighten up when we're sitting down too much, not activating the glutes enough. So there's the TFL is gonna be the front pocket, just above the front pocket. And then you have the piriformis, which is above the back pocket here. Kind of do a little bit of exploring. You're gonna find it. You'll definitely feel it when you find it. And then you hang out and let that thing massage out for 30 seconds on each side. After we do that, we have a figure 4 stretch. We really wanna stretch out that area. So figure 4 stretch, we're gonna put one leg on top of the other, keeping that knee pushed out as much as we can. Sometimes I use my elbow to push it out. We're gonna go ahead and grab our front knee and then lean back and pull back. That should give you a nice stretch in that piriformis right here, giving it nice lengthening. So we go ahead and do about a minute or 2 on both sides. That's really gonna stretch out that area and help strengthen that area. Now we're gonna go ahead and strengthen that glute now that we've released it and stretched it out. Now we kind of want to strengthen that glute so that it helps us to keep that knee out rather than letting it buckle in as we're doing those squats. So what you want to do in this position is we're just going to do a glute bridge. So keeping your feet flat on the floor. I like to do this with my shoes off so I can grip the floor with my toes. And in this position, we're going to come up to the top here, and I want you to squeeze your glutes and pull your belly button through the back of your spine. Notice there's a straight line from my shoulder all the way to my knee. We don't want to do a glute bridge and then be like this, right? We want to get that full extension, squeezing that glute, get that activation in the glute, hold it for a little bit, come back down nice and slow. Come back up, grip the floor with your toes, squeeze it, pull the belly button back, squeeze those glutes, bring it back down, nice and slow. So I recommend doing about 2 sets of those, 12 reps, nice, slow, and controlled. That's gonna help strengthen those muscles. And all of those things put together will help with a knee injury. Getting those things massaged out, stretched out, and strengthening that glute med, that's gonna help you to keep that knee from buckling in when you're doing your squats, which causes a lot of pain, or just walking and your knee buckles in a little bit. And it just helps relieve tension all throughout that whole knee joint, from the bottom of it all the way through the top. There's a lot of muscles that, you know, connect into that area, and we're gonna work on all of those if you continue doing this video. So go ahead, do this video. Let me know how you like it. Let me know if it helped you out, and I'll see you next time. Take care.